from Microbe TV. This is TWiP, This Week in Parasitism, episode 239, recorded on July 12, 2024. I'm Vincent Racaniello, and you're listening to the podcast about parasites. Joining me today from New York, Daniel Griffin.
Hello, everyone.
Even though it's not the clinical update, I can still ask you what's on your bow tie, right, Daniel?
You know, I was thinking about this morning. I forgot that we would be recording this evening, but it's Friday, which means it's sexually transmitted infection day. So I've got my syphilis. You see my purple spirochete on there.
Purple spirochete. Very good. That's right. It's Friday. I should know better. Well, Dixon is supposed to join us, but he's having internet problems, so maybe he'll hop in midway. But meanwhile, we can begin. And before we do, I just want to remind everyone, if you enjoy our work on these podcasts, please consider supporting us. Go to microbe.tv/contribute. So, Daniel, today is the time to crack the case from 2 episodes ago. Remind us what that was.
That is true. So for those tuning in for the first time, for those tuning back in, we have a case of a man in his 60s, HIV/AIDS with a CD4 count less than 50. His CD4% is less than 5%. He has an elevated viral load. We hear that he's had prior CNS, central nervous system toxoplasmosis, that was rather complicated, required a craniotomy. Previously, he's had disseminated Mycobacterium avium complex. And now he comes in with fever and very watery diarrhea for about 4 days. The interesting part of the history that I shared was that he says that he normally lives in Georgia and he comes up to New York for his HIV care. And he was staying in New York, drinking the tap water I shared before he developed these issues.
All right, we have a good number of listener guesses. I'll take that first one from David. Greeting team
from Microbe TV.
TWiP.
This is
I'll
TWiP,
make a quick guess for the case of the HIV positive patient from Georgia who visits New York City for HIV care.
Recorded on
Based
June
on the short
14th,
description of the case,
2024.
the emphasis on drinking the New York City water while visiting and the sudden onset of watery diarrhea, 2 possibilities come to mind: Cryptosporidiosis and giardia. I seem to recall a recent TWiP covering Cryptosporidium 233, as well as discussion of much of the New York City water supply from the Catskills being unfiltered and potentially containing low levels of crypto. My guess for the new case is Cryptosporidium, although testing might be wise to definitively differentiate the cause. Thanks as always for an entertaining and informative episode. David from Maryland.
All right. Justin writes, hello, hosts. With an immunocompromised patient and New York City tap water, my first thought is cryptosporidiosis or a C. diff bacterial infection. Giardiasis could also be possible, but without fatty diarrhea, this seems less likely. There are likely many other differentials for this case, but I think the most likely is a Cryptosporidium species infection, C. hominis or parvum being most likely.
University of Central Lancashire Parasitology Club writes, Dear TWiP professors, greetings from the University of Central Lancashire Parasitology Club in the wonderful northwest of Britain. Today it was a chilly 13°C. However, the week before was an amazing 30 degrees. We ran our Parasitology Club summer school last week, supported by BioConnections UK, with parasite suspensions, and this provided an opportunity for the team students, to practice microscopy skills and parasite identification. Our signed copies of parasitic diseases were highly useful. The clinical case presented looks like a classic case of cryptosporidiosis in a patient with HIV and declining into AIDS. As we learned in summer school, the oocysts can be found abundantly in fecal samples, but are too small and indistinct or identification by microscopy without Nielsen or Auramine staining. Current methods usually rely on immunoassays, such as ELISAs or tests, are included in GI pathogen panels by nucleic acid amplification methods. Thank you for another wonderful podcast and interesting case, Neil.
All right, I like all the references there. Hello from the top of the Alps. Here in South Tyrol, northern Italy, we have nice 21C, 70F, and amazing views. For the gentleman from Georgia presenting with watery diarrhea in New York, I think the causative agent is microsporidiosis. The parasite can spread through chlorinated tap water. Other differential diagnoses would be cryptosporidium or cystoisosporiasis. Stool microscopy should lead to a definite diagnosis. Yours, Fritjof.
John writes, still hoping to win a book and hope not too tardy. Hello, esteemed hosts. Two parasites that came to mind are Giardia and Cryptosporidiosis. However, a few things steered me from Giardia to crypto. Fever is rarely present in Giardia, but common with crypto. The gentleman has compliance with therapy issues, and his weakened immune system is susceptible to cryptosporidiosis, ubiquitous in the unfiltered New York City surface water tap. It also sounds like this is a common enough occurrence that Dr. Griffin recognized it for the HIV/AIDS patients coming to New York City for treatment. Foul odor and floating stool are common for Giardia, but also absent here. Cryptosporidiosis does match signs of voluminous watery diarrhea. In both cases, a stool can be tested with PCR or even a less sensitive microscopic examination. As for crypto treatment, there is an FDA-approved drug, but usually skipped, and getting the client to comply with HIV/AIDS therapy would shore up the immune system to clear the infection.
All right. Ed writes, sunny and cool in Minnesota today, 74F, 23C. Good weather for a bicycle ride. I'm a longtime TWiP listener. I sent you a diagnosis for the first case in May when guests got sick with myalgias after a banquet with game meat. Immediately, I thought it was a trichinosis outbreak, and of course, I was wrong. I was fooled by the most successful parasite on Earth. One can never be too sure about anything in human health, but I'm going to double down on my losing strategy and again go with my first guess. It seems likely that our HIV patient with very watery diarrhea, who is immunocompromised by not taking his antiviral therapy, has cryptosporidiosis. New York City water is unfiltered and heavily chlorinated. Cryptosporidium laughs at chlorine. For the patient's sake, I hope I am wrong. While other people get over cryptosporidiosis without treatment, I remember how bad it was in the AIDS era before HAART, HAART, highly active antiretroviral therapy. Maybe this miserable illness can persuade Daniel's patient to resume HIV meds and extend his life. Ed in Minnesota. And P.S. I attach another photomicrograph, not of cryptosporidium, but of related. This is kind of a nice photo. Related Eimeria, an avian coccidian. All right.
It's a nice picture, yeah.
Yeah, really is.
Felix writes, dear hosts, I am amazed by the diversity of countries that people are writing in from. Yeah, it's pretty cool. You should get a scratch map to keep track of them. As for my guess, there are two parasites I considered when thinking about drinking water, Cryptosporidium parvum and Giardia lamblia. The one I mostly associate with HIV is crypto, so that's my final guess, but it could also be the other one. If I'm right, I anticipate a malaria or babesiosis case next week to keep the apicomplexus streak going. Greetings from South Germany. Felix.
Okay. Tumas writes, hello, it is 29C in southern Finland. The unfiltered tap water of New York City is a recurring theme on TWiP. Unfortunately, I don't know what our patient is suffering from. My differential is 3 parasites used as example of pathogens with environmentally resistant stages. Giardia lamblia, Entamoeba histolytica, Cryptosporidium parvum, and Cyclospora chiatinensis is a 4th alternative. The relevant parts for the diagnosis are patient has HIV/AIDS, watery diarrhea, fever. Giardia, no steatorrhea mentioned, consistent with fever. E. histolytica, consistent with watery diarrhea and fever. It is unclear to me if New York City tap water has E. histolytica. Crypto, consistent with watery diarrhea, inconsistent with fever. Crypto was the solution 3 cases ago. C. chiatinensis, consistent with watery diarrhea, not endemic in North America. In conclusion, I don't know, but it may or may not be one of these. Hot regards.
Agnesi writes, Dear TWiPers, thank you again for interesting cases and scientific evidence discussions. My guess for this new case is Microsporidia. These parasites are worldwide distributed, and reports have found double prevalence among immunocompromised individuals, especially among people living with HIV. Despite being mostly asymptomatic, the severity of the clinic worsens with lower CD4 cell count, which is the case of our patient. The species is likely to be either Enterocytozoan vianusi or Encephalidozoan intestinalis. I'd put Cryptosporidium species and Isospora in the differentials as well, also typical of people living with HIV. Giardia and Entamoeba could also be considered in the differential. A microscopic examination of stools should help with the diagnosis, together with serological and molecular analyses. Treatment should be albendazole if Microsporidia is confirmed, and disseminated diseases should be ruled out to establish the duration of treatment. Antiretroviral treatment should be assured for immunological recovery. Can't wait for the next case. Agnese.
All right, Michelle and Alexander from the First Vienna Parasitology Passion Club, right? Dear TWiP hosts, it seems that lately you've had a lot of cryptic cases on tap. And since we recently submitted a case guess about a patient who presented with Cryptosporidium infection after swimming in a public pool in Florida, we decided to keep it short this time. Also, we're running out of Cryptosporidium puns. Cryptosporidium is a common cause of diarrhea in HIV-positive patients with uncontrolled disease and is usually treated with nitazoxanide or paromomycin. More importantly, the patient should be connected to HIV care and ART. As always, thank you for this great case. All the best.
And the last one is from Hawken. Greetings from sunny, muggy Athens. Thank you for another fun case and another chance to win a book. For this week's case, there were a few protists that come to mind: Cyclospora cayetanensis, Cryptosporidium bovis, parvum, Isospora species, Entamoeba species, or microsporidial infection given our patient's HIV positive status. Without doing an acid-fast staining or PCR analysis, I feel more inclined to lean on the tentative diagnosis without being Cryptosporidium due to the hint about New York City drinking water. Hope all is well with the team, and thanks again. All
All
right, that'll
right.
do it.
Well, we get one more guest, Vincent. It looks like it's just you all by yourself.
Yeah, it's too
When
bad
it,
Dixon isn't here. He's always got good stories to tell, right?
yeah, he would be throwing the stories. We've lost Christina with her wonderful accent.
Well, so New York City drinking water, that was the first clue. So I know I've heard Dixon talk about Giardia and crypto in New York City water. Fever makes me think crypto, and then no stinky floating diarrhea, which would be Giardia. So I would also say Cryptosporidium.
All right. Well, I think that most of us, including you, Vincent, you sort of picked it up just from the history. And this was actually a recent case that I saw while I was working at the nearby academic center. And it was fun to see this with, fresh out of medical school, interns, the rising intern to residents, the medical students on the team. Just to kind of hear the story, put it together before the diagnostic test, just sort of talk about the differential, because, we've moved to a point in medicine that's good and bad. Good in the sense of now we do these molecular tests, so we get a diagnosis, but also, yeah, not as interesting because we know we're going to get the diagnosis anyway. So how much time do we spend sort of, going through our interesting history? So I like the fact that this man normally lives in Georgia, that he comes up for his care. So he's not drinking the New York City tap water all the time. Sort of liked a little bit of the history. So you've been up here for a little bit of time, for this care, and now you've got this diarrhea. And as we've talked about quite a bit, we drink this watershed water here in New York City, where the water comes from the watershed. It ends up in this huge reservoir right there in Central Park that people like to run around. And then people who are immunocompromised will drink that water. And in this case, the molecular testing came back with yes, Cryptosporidium diarrhea. Um, Now the challenge is, what do we do here? Twofold. One is we got to have that heart to heart about, you really need to take your heart. Hopefully people caught that. That was an accidental but very
Mm.
effective pun. HEART and HAART, because you really got to reconstitute that immune system. You got to get that viral load down. But in a situation like this, as one of our emailers suggested, we actually will use the nitazoxanide. We'll do that twice a day for about 14 days. Otherwise, this can go on in an immunocompromised individual, not for just a matter of days, but actually for months. I've seen it last like 2-3 months without resolution until they finally got treated.
So is this a common occurrence in New York City, Daniel?
It actually is quite common. There was an episode in Milwaukee, so I'll be Dixon for a moment, where this got into the drinking water there, and hundreds of people were sickened. Well, all of those folks had HIV, they had low CD4 counts. It was sort of a marker for who in the community had the immunocompromise. So if you're living in a place like New York City, this is something that's quite often in the drinking water, particularly in the spring, right? You get a lot of heavy rains, things get washed into the watershed, into the drinking water. Gentleman like this comes up from Georgia, has a few glasses of that wonderful New York City drinking water,
Mhm.
ends up with the Cryptosporidium. So it's a New York City thing. It's a seasonal thing. It's an immunocompromised thing. I mean, most of us, we did see an exception a few episodes back. We get this, it lasts for a few days. We don't think anything of it. We move forward. The diagnosis is often never even made, unless in some cases it's quite as profound as it was in that immunocompetent individual that we presented a little bit back. So this is much more of your classic New York City immunocompromised, low CD4 count coming in with just profuse, horrible diarrhea.
So is this happen in other cities or is this unique to New York?
So it happens in other cities, like I mentioned, where it got into Milwaukee, and I think there was some issue with some valve that needed replacing. But yeah, if you are in an area where they're just using chlorination, chlorination is not great. I was actually, before this episode, I was looking at my I've got this little app on my phone, this Johns Hopkins app. And there's kind of this, I'm going to go to this interesting part where they actually talk about um, how resilient this organism is. Let me just cruise on down to it. So here I go. And they basically say, lakes, rivers, saltwater beaches, swimming pools, all can be contaminated. Some municipal water supplies, such as New York City, can be contaminated. During boil water advisories, and every so often we hear about those across the U.S., particularly out there in Michigan, right? Boil water times 3 minutes, use a submicron personal use filter with a 1 micron filter. Remember, ice can be a source, and the parasite can survive at recommended chlorine levels of 1 to 3 milligram per liter, pH 7.2 to 7.8 for greater than 10 days. So really a resilient oocyst, a really resistant infectious stage.
So how do they get into the reservoirs to begin with?
So the animals, they can actually infect the animals.
So the animals wandering around the reservoir are
Yeah,
infected.
yeah.
They're shed. What,
They're doing their business. It rains nice and heavy that gets flushed down into the watershed and then ends up in our New York City reservoir.
also, I guess people campers who drink stream water can get
Yeah,
infected,
you
right?
can definitely get this. I remember a few years back, I shared a case of a young woman in her 20s who got this in the mountains of Colorado. There's also the issue that, let's say this individual goes to a municipal pool. Let's say you swim in
Right.
that public, oh, it's chlorinated, I'll be just fine. So we actually have to also advise this individual, hey, you don't you go swimming in a pool until you're all better plus 2 weeks so that you're not shedding anymore.
So what did you do with this individual, Daniel?
So the big the big discussion about the importance of being on antiretroviral therapy, getting on the nitazoxanide treatment, um, and we actually did a little bit of anti-motility agents just to sort of patch things up as they healed. But they did quite well. They had a good response.
And
Really, it was, I'd say, a very entertaining gentleman from Georgia. I like that alliteration in one of our emails. And he really seemed to see the light. So there's my optimism shining through. In the future, we'll see if that light continues to be seen and if he continues on therapy.
so this gentleman had some issues staying on therapy, right?
Yeah, a lot of times people don't sort of appreciate the importance of taking that medicine until something like this happens. I mean, as you can see, this individual had issues with toxoplasmosis, pretty severe issues with a craniotomy. They had disseminated mycobacterial disease. Now they've got this horrible diarrhea. So, it may take several times before they get the message.
All right. Let's give away a book here. And so I'm just numbering people who I think did not win a book. Let's see, that's Felix, number 6. Tuomas, number 7. Who else said? Agnesi won a book. Michelle and Alexander won a book. And number Khan, right, number 8. So we have 8 eligible guessers. We have to do a random number
Okay.
generator between 1 and 8. Generate. The number is 3. Number 3. That would be Fridtjof. Fridtjof from the top of the Alps.
All right.
South Tyrol, northern Italy. Wow, that's pretty cool. So, Fridtjof, send an email to TWiP at microbe.tv. And in the subject line, put TWiP 239 book winner, and then send us your address and phone number. And we will ship you a book post haste for your enjoyment.
All right. So that's how you pronounce Fridtjof.
Fridtjof, yeah.
Fridtjof. All right. So I think I didn't pronounce it correctly. So there we go.
And, all the others,
Congratulations.
keep trying because eventually the force will be with you. Okay, time for a new case, Daniel.
All right. Well, people sometimes feel like there's a method to my madness, but a lot of times it's just what comes in the door. And we see parasitic cases on a regular basis here in New York. So this was a gentleman that I saw the last weekend that I was on call. So fresh off the presses, so to speak. This is a gentleman in his 70s, originally from mainland China, then lived in Hong Kong, but he's been living in the US now for several decades, ended up admitted to the hospital with fever for 6 days. Initially, I went in the room, tried to take a history. He just was having nothing of it. So I got my sort of prepared myself, started again in Mandarin, got the translator, and then apparently he spoke perfect English, but he apparently required me to start the conversation in Mandarin before he would respond. Unfortunately, my poor partner, who doesn't speak any Mandarin, got the limited history responses from there on out. But we are able to get a little bit of a history after that introduction. It turns out that this gentleman was having this fever, went to see his primary care physician in Queens. This individual lives in Queens, sees the primary care provider who does some blood work. The blood work reveals a rather low sodium. A normal sodium would be about 140, lower limit of normal, maybe 135. He's down at 123. Also on this blood work is a normal white blood cell count, but an increased monocyte count. Patient also shares with us that in addition to the fever, he's experiencing drenching sweats. Tells me it's so wet that he actually needs to change his clothes. He feels like so much sweat he could wring them out. He's retired. He's not working, but he says he spends a lot of time outdoors, walking in the local parks in Queens, but he does not leave Queens. He's had no significant travel. And he says he just doesn't feel that sick. It's just these really high fevers and the drenching sweats.
Hmm.
As far as past medical history, hypertension, BPH, so he's got that big prostate, no prior surgeries. As mentioned, he's retired. He doesn't have a wife. He does report that he has an adult son. No pets, no exotic exposures, and again, no recent travel. He basically has not left Queens except to come to the hospital where he's seeing me. He is febrile to 39.5. He's a little bit of tachycardic. He's got a little bit of an increased heart rate. He does meet the sepsis criteria. His physical exam, though, is otherwise unremarkable. He actually looks reasonably well. His labs, he has a normal white blood cell count, but the eosinophils are
Hmm.
0. His percent of neutrophils is elevated, as well as the monocytes. His sodium, as mentioned, 123. He does have a slight elevation in his serum aminotransferases. That's that AST and ALT. His platelets are a little bit low. He has a low hematocrit, so a little bit anemic. He gets the full, CT, chest, abdominal, pelvis, which is unremarkable. And I'm going to leave people with what are your thoughts? I was thinking about this, that, okay, so we're telling you it's going to be a parasite. We've given you this whole story. There might be a certain parasite that's coming to mind.
So Daniel, he was married, but no longer.
He was a little bit vague about that. He said, "I have no wife." I was
But he
like,
has
"All
a
right."
son. He has a biological son.
But he does have a son. He does have a son. So
Okay.
we know the biology on that one, but
Okay. And he's HIV negative.
he's HIV negative.
Doesn't have a
Yes.
girlfriend or a boyfriend or anything.
No, he's heterosexual, and currently does not have a partner.
And where does he eat?
I asked him about that, and he eats out and about. Sometimes he prepares food. He doesn't have any particular dietary restrictions or any special dietary exposures that we hear about.
And he's retired, so he stays home most of the time. Is that right?
Yeah, he says he stays home. He'll go out for walks through, the neighborhood, local parks, stuff like that. But not leaving Queens, right? So this is, he's in the Flushing area, right? So a
Mhm.
fairly urban part of the world.
And he goes walking in parks.
Yep. But remember, these are urban parks. So just sort of think about this is not Eastern Long Island. This is not upstate New York. So just things that we may or may not have in our city urban environs.
And what time of the year is this happening? What season?
So this just happened. So this was, yeah, I should look at my calendar. I'm going to say end of June. Yeah, end of June just happened.
So summertime. Okay.
Yeah.
All right. You can send your guesses to TWiP at microbe.tv. You should put TWiP 239 in the subject line. We'll be cracking this case in about a month, right, Daniel?
Yes,
So
yes.
today is the 12th of July. So I will give you the exact date. August 9th will be the reveal for this case. So you should get your guesses in, let's say, by August 5th. You have to send them to TWiP at microbe.tv and put TWiP 239 in the subject line. That'll do it for TWiP 239. Very short because Dixon's not here.
I know, he really always has a lot of stories. He would have taken this episode and doubled its length, dare I
Which
say.
is a good thing, though, because he's got good stories, and we want to get them recorded for posterity. But
That is true. And I have to say, I was listening to TWiP 238 earlier today while driving about, and that's one where Mike Barrett joined us, and we hear the stories of Livingstone. I always pronounce that differently. But that's a great one. So if you want about 90 minutes, a really deep dive, listen to TWiP 238. And if you want a quick solving a mystery case, here you got.
all right, that's TWiP 239. Show notes at microbe.tv/TWiP. Send your questions, comments, guesses, TWiP at microbe.tv. And if you enjoy our work on these programs, please consider supporting us financially. Microbe.tv/contribute. Daniel Griffin is at Columbia University Irving Medical Center, parasiteswithoutborders.com. Thank you, Daniel.
Oh, thank you. And everyone be safe.
I'm Vincent Racaniello. You can find me at microbe.tv. I'd like to thank the American Society for Microbiology for their support of TWiP and Ronald Jenkins for the music. You've been listening to This Week in Parasitism. Thanks for joining us. We'll be back in 2 weeks. Another TWiP is parasitic.
Excellent.